Today we discuss about antileprotic drugs. Antileprotic drugs. Okay, what is leprosy? Leprosy caused by Mycobacterium lepra. The causative microorganism is Mycobacterium lepra. Has been considered. Hey, why your neck sound? Listen carefully. Only you have to listen, and do not only few points you have to write. Just like your Mycobacterium lepra, something you have to write and carefully listen. Okay. Leprosy caused by Mycobacterium lepra. This is the causative microorganism. Has been considered in why making sound? Has been considered incurable since ages and bears a social stigma. Okay, but nowadays it is entirely curable. Nowadays it is entirely curable. Okay, then chalmugra oil, the Ayurvedic preparation, chalmugra oil with weak antileprotic property. কাই কথা হচ্ছে মানে সে অপরলি কথা হচ্ছে Chalmugra oil with weak antileprotic property was used in Indian medicine for centuries. Okay, Chalmugra oil, it is a Ayurvedic preparation. Then we discuss about the classification of antileprotic drugs. You must have to remember all the classified drugs. Okay, you have well written in the internal one. The drugs are very distinctly written by you. Thank you for all. Then the classification one is sulfon. Okay, that is dapsone. What is dapsone? That is diamino diphenyl sulfone. Diamino diphenyl sulfone. Okay, what is the structure? What is the structure of dapsone? That is the structure of dapsone is this is the structure of dapsone. Diamino diphenyl sulfone. Diamino diphenyl. This is sulfone. This is your sulfone. This is the structure of dapsone. It is a sulfonamide. It is an example of sulfonamide, and it is used for the treatment of leprosy. Okay, that is known as dapsone. DDS, diamino diphenyl sulfone. Then number 2 is phenazine derivative. The example is clofazimine. Then number 3, anti-tubercular drugs. Anti-TB drugs or anti-tubercular drugs are also used for the treatment of leprosy. And the examples are rifampicin or rifampin and ethionamide. Okay, ETH. Then other antibiotics are ofloxacin, moxifloxacin, minocycline, clarithromycin. All these are used for the treatment of leprosy. This is about the classification. You have to write the classification of anti-leprotic drugs. Okay. The first we discuss about the dapsone. What is dapsone? This is the structure of dapsone. Okay. Diamino diphenyl sulfone. It is diamino diphenyl sulfone. The simplest, oldest, cheapest and most active and most commonly used members of its class. Okay. Then activity and mechanism of dapsone. Dapsone is chemically related to sulfonamides. Dapsone is chemically related to sulfonamides. in the antibiotics we have studied sulfonamides. Okay, sulfonamides are antibacterial, okay, anti-malarial also, sulfonamides. Dapsone is chemically related to sulfonamide and has the same mechanism of action, that is inhibition of PABA incorporation. Inhibition of PABA incorporation. Okay, PABA is an important part of folic acid and it has the similar structure. Dapsone has similar structure like PABA. Okay, dapsone has similar structure like PABA, and instead of PABA, the dapsone is incorporated. That's why it will inhibit the dapsone inhibition of PABA incorporation into folic acid, and folic acid is an important constituent of bacterial cell. Okay, inhibition of PABA by folate synthase. This is an enzyme. Okay, the antibacterial action of dapsone is antagonized by PABA. It is leprostatic. At small doses, at very low dose. What do you mean by leprostatic? It will only inhibit the growth. Leprocidal means it will kill. Okay, it will kill the Mycobacterium lepra. But leprostatic means it will only inhibit the growth of Mycobacterium lepra. Okay, that's why it is known as leprostatic at very low concentration, while growth of many other bacteria sensitive to sulfonamides is arrested at relatively higher concentrations. Okay, at higher concentration they may be bactericidal or leprocidal. Okay. Then dapsone is active against certain protozoa as well. Combined with pyrimethamine, it is an alternative to sulfadoxine pyrimethamine for Plasmodium falciparum. I have just tell you now that it is anti-malarial also, or it is a preventive for malaria parasites. Okay, or Plasmodium falciparum. It is a type of malaria. Okay, it is a dangerous form of malaria. Okay, when the dapsone is combined with pyrimethamine, it will form anti-malarial preparation. Okay, then uses are there. Contraindications: when it will not be used, dapsone should not be used in patients with severe anemia. Okay, when the patients are suffering from anemia with G6PD deficiency. What is G6PD deficiency? Glucose 6-phosphate dehydrogenase. It is an enzyme. Okay, the enzyme deficiency of the patient, they should not treated with dapsone. Okay, then next drug is clofazimine. It is a dye with leprostatic and anti-inflammatory properties. It is a type of dye, means color. Okay, with leprostatic and anti-inflammatory properties. The anti-leprotic action of clofazimine are: what is the mechanism of action? Interfere with template function of DNA in M. lepra. Template function in DNA. Means DNA will replicate. DNA acts as template. Okay, and it will interfere in that process. Alteration of membrane structure and its transport function. Membrane structure. It is a plant, bacteria. Bacteria is a plant or animal. It has cell wall or not? It has cell wall. Okay. Alteration of membrane structure. Likewise, the permeability will be altered. Our cell membrane is a semi-permeable membrane or selective permeable membrane. Some substances are incorporated into, not all substances are incorporated. Some substances are incorporated. If the membrane structure will be altered, then the cell, the bacteria will die also. these substances which have not to be transferred into the cell, these can cross through. Okay, this is about your membrane structure. It will alter the membrane structure and its transport function. Transport means through the membrane, the active transport, passive transport are there, and it will totally altered due to the structural differences of the cell membrane or cell membrane of the bacteria. Okay, then disruption of mitochondrial electron transport chain. Disruption of mitochondrial electron transport chain. By the help of mitochondrial electron transport chain, the energy will be liberated in the form of ATP. Okay, and it is also disrupted, means the energy cannot be produced properly by use of clofazimine. Okay, these are the mechanism of action, how it can kill the bacteria or inhibit its growth. Okay, this is about your clofazimine. It is also a classified anti-leprotic drugs. Adverse effect in the doses employed for MDT, clofazimine is well tolerated. Okay, skin, the major disadvantage is reddish black discoloration of skin, especially on exposed parts. Okay, and other adverse effects are also there. Then the third drug, that is known as ethionamide. This anti-tubercular drug has significant anti-leprotic. It is anti-tubercular drugs. In the anti-tubercular drugs, we have studied ethionamide. Along with anti-tubercular property, it has also anti-leprotic property. Okay? It is poorly tolerated and causes hepatotoxicity. It will cause hepatotoxicity. Then ofloxacin. What is ofloxacin? Classification of ofloxacin. It is a fluoroquinolone antibiotic. What is the example of quinolone antibiotic? Nalidixic acid. Yes, nalidixic acid. And fluoroquinolone antibiotic, ciprofloxacin, ofloxacin, norfloxacin. Okay. Many fluoroquinolones like ofloxacin, pefloxacin and moxifloxacin highly active against Mycobacterium lepra. But ciprofloxacin has poor activity. Clinically, ofloxacin has been used to the large extent. Okay. Then minocycline. It is another class of anti-leprotic drug because of high lipophilicity. What do you mean by lipophilicity? Philic means, what do you mean by philic? Nucleophilic, electrophilic, addition reaction. Yes, philic means loving. Okay. Because of high lipophilicity means attraction towards lipids. That is known as lipophilicity. The cell membrane is made up of lipoprotein bilayer. Lipids are there. Okay. Because of high lipophilicity, this tetracycline penetrates into Mycobacterium lepra. Okay, the bacterial cell wall or bacterial cell membrane is made up of lipids. Due to high lipophilicity of minocycline, it can easily penetrate into the bacterial cell through its membrane. Okay, active against them. A dose of 100 milligram per day produces peak blood levels that exceeds inhibitory concentration. Minimum inhibitory concentration against M. lepra. Okay. Then clarithromycin is another drug. It is only macrolide antibiotic. Clarithromycin is the macrolide antibiotic. And what are the other examples of macrolide antibiotic? Do you know? Azithromycin, erythromycin. These are also macrolide antibiotic. But only clarithromycin is the macrolide antibiotic which is active against Mycobacterium lepra. Okay. This type of GPET question also arises. These are very critical questions. It is the only macrolide antibiotic with significant activity against M. lepra. Which macrolide antibiotic is active against Mycobacterium lepra, that is clarithromycin. Okay. Then treatment of leprosy. Treatment of leprosy, you have to describe it in your answer paper. What is the procedure? What are the standard procedure for the treatment of leprosy? Okay. Leprosy is a chronic granulomatous infection caused by Mycobacterium lepra. Okay. And many patients National Leprosy Eradication Program. You have to remember this. What is NLEP? What is NLEP? The question will be arise. What is NLEP? That is National Leprosy Eradication Program. National Leprosy Eradication Program. Okay. Tapare MDT. What is MDT? Multiple drug therapy. Multiple drug therapy. MDT. MDT. Abbreviated words are there. You have to, if question arises, what is MDT, you have to write multiple drug therapy. What is NLEP? That is National Leprosy Eradication Program. Okay. Leprosy manifests in several clinical forms. The most widely used classification of leprosy has been classified. What are the different types? Just like your different types of malaria. We have studied different types of malaria: Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malaria. 4 types of malaria parasites are there. Just like the leprosy are different types. The leprosy are different type. Okay. Divided leprosy into lepromatous, that is LL. Lepromatous leprosy is known as LL. Then borderline lepromatous, that is BL. Only borderline, that is BB. Our borderline tuberculoid, that is BT, and tuberculoid, that is TT. These are the different forms of leprosy. These are the different types of leprosy. Okay. And the important features of 2 polar types are these are the differences. These are the differences of tuberculoid leprosy and lepromatous leprosy. Okay. Here what are the symptoms that causes by the infection of different type of leprosy? In case of tuberculoid leprosy, the anesthetic patch is there, cell-mediated immunity is normal, tapre lepromine test positive, tapre prolonged remission with periodic exacerbation. Okay. Then for lepromatous leprosy, diffuse skin and mucous membrane infiltration nodules. Okay. Tapre lepromine test negative, progress to anesthesia of distal part, atrophy. Okay. In case of leprosy, the fingers has been caught. They are begging. Previously, the patients, the people who are suffering from leprosy, they are begging at the street below the shadow of banyan tree. We have sown. Have you sown? No. We have sown. In our generation, this is the thing happening. For operational purposes, WHO divided leprosy into Paucibacillary leprosy, that is known as PBL, Paucibacillary leprosy. Patient has few bacilli and is non-infectious. It includes the TT and BT type. What is TT? TT is tuberculoid and BT is borderline tuberculoid. Okay. Then number 2, multibacillary leprosy, MBL. Multibacillary leprosy, that is MBL. Patient has large bacillary load and is infectious. It includes LL, BL and BB. What is LL, BL and BB? LL means lepromatous, BL means borderline lepromatous and BB means borderline, only borderline. Okay. Paucibacillary, PBL and multibacillary, that is MBL. To further simplify the classification so that it may be applied at the field of level, WHO reclassified leprosy in 1998. Okay, that is known as single lesion possibacillary leprosy, that is SLPB. Single lesion possibacillary leprosy, that is known as SLPB, with a solitary cutaneous lesion. And another is possibacillary leprosy, that is known as PB, with 2 to 5 skin lesions. Both SLPB and PB cases are skin smear negative for M. lepra. Tapre multibacillary leprosy, that is MB, with greater than or equal to 6 skin lesion, as well as all smear positive cases. Okay. The classification being followed by NLEP, National what is NLEP? National Leprosy Eradication Program. Okay. Since then conventional, all forms of leprosy had been treated with dapsone alone. It is important. It is important. But it has been written. You look forward. Why you are down your head? Conventionally, it has been written. Conventionally, तमरो सेकंड सेम रे कोन तांकर लाइव क्लास चलथिला, they are looking mobile, that's why they are down their head. At the time of classes, they online attend the class. Live classes are there. Okay. Conventionally, all forms of leprosy had been treated with dapsone alone. All forms of leprosy. What are the different types of leprosy we have studied? What are the different classified of leprosies we have studied here? All types of leprosy are treated by dapsone alone. Only the dapsone is sufficient for the treatment of or for killing the Mycobacterium lepra. Monotherapy, that is empty. What is the dose? You have to remember the dose. You have to remember the dose. What is the exact dose? 100 to 200 milligram daily, 5 days a week. Duration of treatment depending on the type of TT. Okay, 4 to 5 years for TT, tuberculoid, 4 to 5 years, 4 ରୁ 5 ବର୍ଷ ଖାଇବା ପାଇଁ ପଡିବ. For LL, 8 to 12 years or lifelong ଖାଇବା ପାଇଁ ପଡିବ. Lepromatous. LL ଟା ତମର TT, tuberculoid, and LL means lepromatous. For lepromatous, the lifelong therapy should be there. And for TT, what is the duration of treatment? That is 4 to 5. Just like your diabetes, if you are suffering from diabetes, lifelong therapy should be there. If you are suffering from blood pressure, lifelong therapy should be there. Okay. Likewise, for leprosy, you have to take medicine for lifelong. Okay. Then we discuss about the multi-drug therapy, MDT, of leprosy. To deal with dapsone-resistant strains of M. lepra and to shorten the duration of treatment, as well as to eliminate the microbial persisters or dormant form if possible, multi-drug therapy with rifampin, dapsone, and clofazimine was introduced by WHO in 1981. Previously, only dapsone is the drug of choice for the treatment of leprosy for lifelong or 4 to 5 years. But this is a very complicated process. It is very difficult to take medicine for lifelong. That's why multi-drug therapy is there. It will be invented, multi-drug therapy, and the multi-drug therapy includes. What are the drugs includes in multi-drug therapy? Rifampin, it is a anti-tubercular drugs, then dapsone, then clofazimine. You have to take 3 drugs simultaneously. Okay, that is rifampin, dapsone, and clofazimine. This was implemented under NLEP in 1982, National Leprosy Eradication Program. The MDT is the regimen of choice for all cases of leprosy and its advantages are What are the advantages of taking multiple drug therapy? That is known as rifampin, dapsone and clofazimine. What are the advantages? Effective in cases with primary dapsone resistance. Okay, the bacteria which make resistance against dapsone, it is effective against multi-drug therapy. That is rifampin, dapsone and clofazimine. Okay, then prevents emergence of dapsone resistance. It will prevent the resistance of dapsone and affords quick symptom relief. It will afford if multiple drug therapy is there with rifampin, dapsone and clofazimine, it will provide quick relief, quick symptom relief and renders MBL cases or non-contagious within few days. Then reduces total duration of therapy. It will reduce the time, duration of time. For TT it is 4 to 5 years, for LL it is for lifetime. But if we use multiple drug therapy, it will reduce the duration of therapy. Okay. Then initially under standard MDT, the PBL cases were treated with dapsone plus rifampin for 6 months only. Okay, 4 to 5 years is reduced to only 6 months. Multiple drug. What is the advantage of multiple drug therapy? Dapsone plus rifampin for 6 months only, while MBL cases were treated with dapsone plus rifampin plus clofazimine for a minimum of 2 years. For MBL by 2 years. Okay, or till disease inactivity or skin smear negativity was achieved. Okay, the skin smear test is there. Up to it will show the negative test. You have to take the 3 combined drugs, that is known as dapsone, rifampin plus clofazimine. This is about your antileprotic, then antifungal drugs, then fungal infection. All type of skin infection are primarily fungal infection, fungus. Okay, these are the drugs used for superficial and deep or systemic fungal infection. Okay, then we will discuss the classification of antifungal drugs. Classification, you should remember all the classified drugs. Okay, classification is important. If you are writing the correct classification of drugs, then the examiner will give mark with his closed eye. He will close the eye and give the mark if you have written the classification correctly. Okay, then classification of antifungal drugs, that is known as antibiotics. First of all, antibiotic, it is polyene antibiotic. The polyene means, what do you mean by polyene? What is the meaning of "in"? Double bond. In a molecular structure, if there are multiple double bonds are there, if the antibiotic contains more than 7 or 7 number of double bonds, then it is known as polyene antibiotic. And the example is amphotericin B, AMB, nystatin, hemicin, etc. These are polyene antibiotics. Then echinocandins तमरा कैस्पोफोंगिन आउ मिकाफोंगिन. Okay, then heterocyclic benzofuran. It is heterocyclic. Benzofuran is a heterocyclic structure. Okay, heterocyclic benzofuran, that is known as griseofulvin. It is antifungal antibiotic. It is very important. Okay, the griseofulvin is what? It is a benzofuran. It is a type of medicinal chemistry question. What is griseofulvin? It is benzofuran. The benzofuran heterocyclic ring structure is there. Then antimetabolites. Antimetabolites example is flucytosine. Yes, very good. Flucytosine 5-FC. Okay, then azoles. The azoles, first one is imidazole, Imidazole. Imidazole belongs to azoles. Okay, azole. And the topical application, for topical application, it is clotrimazole, iconazole, miconazole, oxyconazole, and for systemic it is ketoconazole. For systemic it is, it means it will be applied in injectable form. Okay, ketoconazole. Then triazoles. After azole, we discuss triazoles for systemic: fluconazole, itraconazole, voriconazole, posaconazole. Okay. Then number 4 is allyl amines. Allyl amines. Terbinafine. Terbinafine is also antifungal. It belongs to class allyl amines. Okay. Allyl amine. Okay. Then other topical anti agents are tolnaflate and dicyclinic acid, benzoic acid. Okay. Cyclopirox. These are other antifungal drugs. Okay. First of all, we have to discuss about the polyene antibiotics. Polyene antibiotics. What do you mean by polyene antibiotics? Number of double bonds are
4 to 7.
4 to 7. 7 number of double bonds are there in the structure. That's why it is known as polyene antibiotics. The name polyene is derived from their highly double bonded structure. The structure contains more number of double bonds. That's why it includes polyene antifungal drugs. Okay. Amphotericin B is described as the prototype. It is the prototype antifungal polyene drugs. Okay. Chemistry and mechanism of action. The polyene possesses a macrocyclic ring, one side of which has several conjugated double bonds. Conjugated double bonds. What do you mean by conjugated double bonds?
Double bond, single bond, double bond. Single.
Yes. Conjugated double bonds are there. Okay. The polyenes have high affinity for ergosterol present in fungal cell membrane. Okay. The amphotericin B, that is polyene antifungal drug, it has high affinity for ergosterol, which is present in the cell membrane of the fungus. They combine with it and get inserted into the membrane, and several polyene molecules together orient themselves in such a way so as to form a micropore. Okay, they will form a micropore. In the ergosterol present in the fungal cell membrane. Okay, the polymer high affinity. With the ergosterol, the amphotericin B has high affinity, means high attraction. They will accumulate, or they will arrange themselves. And they will form a micropore. The amphotericin B. Okay, just like if the structure of amphotericin B is like that. Okay, they will form a micropore. This is the micropore of the cell membrane. Through this micropore, the unwanted substances get entered into the bacterial cell or get entered into the fungal cell. Okay, through this membrane. Because amphotericin B has high affinity towards the ergosterol, which is present in the cell membrane of the fungus. Okay, and it will form a micropore. Orient micropore, the hydrophilic side forms the interior of the pore. Okay, the hydrophilic and hydrophobic. Okay, the hydrophilic side forms the interior of the pore through which ions, amino acid and other water soluble substances move out. From the fungal cell, the essential substances are moved out from inside. These are the essential substances. What are the essential substances? The ions, the essential amino acids, there and water soluble substances move out from the interior of the cell to the outside. Okay. The micropore is stabilized by membrane sterols which fill up the spaces between the A and B molecule on the lipophilic side and constitute the outer surface of the pore. The cell permeability is markedly increased. The cell permeability, it will form the micropore and the permeability of the cell will increases. Thus, the fungus will die. Okay, by the help of amphotericin B. This is the mechanism of action. The permeability changes. The permeability increases. Whatever the essential substances present inside the fungal cell, it will be liberated out. Thus, it will die. Okay. Then cholesterol present in the host cell membrane closely resembles the ergosterol. The polyene binds to it as well, though with lesser affinity. Okay. Okay, this is all.